Sexual harassment and assault has recently taken the spotlight, but there is a group of people at high risk of being assaulted that rarely get talked about. News 8's Madeline O'Neill is here with more.
Lisa, NPR reports that people with intellectual disabilities are sexually assaulted at a rate 7 times higher than others. And area health officials say one step to addressing the problem is raising awareness.
They're out there and we're seeing them in our hospitals.
Since July,
Just sad.
sexual assault nurse Kathy Bryant says Mayo Clinic Health System saw at least 7 intellectually disabled people who were sexually assaulted.
That's pretty high.
And although NPR reports the population is at high risk for sexual assault, the cases often go underreported.
And then perhaps even they're concerned that somebody's not going to believe them because of their intellectual disabilities, or perhaps even their ability to put to words what has happened to them.
They've also learned their entire lives that compliance is an important part.
Gunderson sexual assault program advocate Chelsea Sen explains in most sexual assaults, the victim knows the perpetrator. That's even more likely to be the case if the victim is intellectually disabled.
If they're told by somebody that is a trusted individual to them to keep something a secret or be quiet, they're more likely to follow that direction.
So if you're a perpetrator, they are your perfect victim. Nobody's going to believe them. They're going to have a harder time reporting it. They're not going to know who to report to.
La Crosse is Aptive, formerly known as Riverfront, provides on-site support services for about 300 people with disabilities.
People with disabilities need a voice.
Aptive's marketing communications director Nate Hunt says his clients are a vulnerable population who need advocates against violent crime, but also against issues such as poverty.
I think it's important to raise awareness about the unmet needs of people with disabilities in general. When those other unmet needs can be met, that limits people's vulnerability.
Bryant says everyone needs to pay attention, listen, and ask questions.
We need to ask the question in a way that they can understand and give them the opportunity to answer.
Now, Mayo has an advocacy program that helps sexual assault victims after the assault, finding them a safe place and helping them through the court system. Gunderson is also focusing on prevention efforts toward vulnerable populations, including those who are intellectually and developmentally disabled.
Now, what demographic do hospitals see sexual assault occur in the most?
The Mayo sexual assault nurse I spoke with today said women ages 18 through 24, that's the population they see the most sexual assault with.
All right, thank you so much, Madeline.
You're welcome.